Hi, this is Dr. Shaina Rozell. I am a hematologist oncologist with Affiliated Oncology out of Chicago, Illinois. Today, we'll be discussing metastatic breast cancer. This is MD Newsline. If you're giving a CDK4/6 inhibitor, depending on which one, the most common side effects are low white count or neutropenia. And so in some of those, you actually have to hold the drug. Some of them, you have to give them growth factors. Some of them, you have to give them prophylactic antibiotics because of a higher risk of infection. There are other side effects that some of the CDK4/6 inhibitors have, such as diarrhea. And in those cases, we can really give them supportive measures. And so I commonly say, hey, I need you to drink more fluids. I can give you supportive medications such as Imodium, loperamide. Sometimes in cases, I may give them atropine, really to help reduce that diarrhea. Other side effects are lethargy, so really encouraging them to be a little bit more active and engage in physical activity. Some of the other side effects are heart-related, and so it's really up to the provider to make sure that they are monitoring their EKGs and making sure that we are not giving them medications, for instance, that will interact with the medications that they are on. With the advent of some of the newer targeted therapies, some of them can cause diabetes or increase hyperglycemia. And so sometimes you have to put them on diabetes medications and watch and monitor their blood sugars a little bit more carefully. And so I think with the coordination with the oncologist as well as with the primary physician, that I think, kind of supporting the patient, I think is the best way to go. So with these side effects, one of the questions that I get is, how do I balance efficacy with toxicity? So it all depends, one, on the patient. So if I have a patient who has a performance status of 3 or they're more frail or more elderly, I'm not going to give them a really aggressive medication that I don't think that they can tolerate. Similarly, it's with discussion with the patient, and you're going over the adverse events and discussing these side effects. Some of the patients say, do everything you can, I'll get through it. Others really focus on quality of life. And so if you're having that conversation with your patients and you're educating them about these are some of the adverse reactions that you can have, and this is how we would manage it, then I think you can work together and also help the patient. When we're talking about primary providers, and especially oncologists, efficacy is extremely important. We want a medication that works with limited side effects. So what supportive care mechanisms do I have to assist our patients? And so I think, number one, when that patient enters the door, I think the first support is to have a family member or a friend or someone who is available to be able to listen to these adverse reactions. I think patients who come alone, a lot of times they're not able to really absorb the information and they do not ask questions. Those patients who have support and have a friend or family member that is listening, they seem to be more engaged. And if they're not listening, their counterpart is also listening. So that is the first thing. Number two, I think it is always important to have a patient navigator. That your patient navigator is that one from the physician side that can actually come and call the patient to do a toxicity check to see how they're doing. Usually I have my patients follow up with me a little bit more frequently when they are starting the medication, just to make sure that they're tolerating it without any significant side effects. Third, many of the drug reps also have a resource where they actually are calling the patient to reach out and make sure that they're tolerating the medication as well.